Hello, everybody. My name is Amitha. I'm from St. Francis Hospice. I'm a palliative care nurse there and working as practice development nurse there at the moment. So I would like to acknowledge my supervisor, Anita Duffy, in this presentation as well, and thank you for this opportunity, first of all. This study is actually, this is an evidence synthesis part of the Masters in Palliative Care program I have undertaken just this year, just finished in this May in UCD. So the title is The Impact of an Education Intervention in Developing Critical Thinking Nursing Skills in Non-Specialized Nurses Practicing in Specialist Palliative Care Services. The nursing shortage is a global concern directly related to patient safety, and it's actually impacting the availability of qualified nurses to work in specialist areas. And this leads to organizations, healthcare organizations, employing non-specialized nurses to work in specialist areas. And in specialist areas, same in specialist palliative care as well, like the healthcare professionals required to be competent, knowledgeable, and critical thinkers to provide holistic management of complex palliative care symptoms of our patients with life-limiting conditions. So lack of knowledge, preparedness, and critical thinking abilities can lead to patient safety concerns. And critical thinking is fundamental to clinical decision-making and competence. And so it's very significant. And interconnection between nurses' critical thinking skills and role of education is widely recognized. Researchers have extensively engaged with research in researching the impact of education interventions in developing critical thinking skills in nursing students, and also some areas like critical care nursing, acute care nursing, they have also explored this area. However, despite the significance, very little research was performed in a specialist palliative care context. So the aim of this study was to investigate the effectiveness of education interventions in developing critical thinking skills in non-specialized nurses practicing in specialist palliative care services. This was an intervention type study, and using PICOF framework, population was non-specialized nurses working in specialist areas, palliative care areas. Intervention was education and training and outcome critical thinking skills. And a comprehensive search strategy was performed using CINAHL and PubMed database, and 1,076 articles were retrieved from the search. And the inclusion criteria was mainly focusing on specialist palliative care and also the non-specialized nurses working in specialist palliative care. And from these 1,076 articles retrieved, there was, seven quantitative studies were selected for this evidence synthesis, and 5 of them were pre-test post studies, 1 descriptive cross-sectional, and 1 was pilot RCT. The integrity of the methodologies and designs were critically appraised using in terms of validity, replicability, and reliability. And also the Joanna Briggs Institute hierarchy model of evidence was used to rate the studies. And also the quality of the studies also further explored using quality assessment tools, CASP tool, and Access tool. And findings from this evidence synthesis supports the positive impact of educational interventions in enhancing non-specialized nurses' knowledge, attitude, self-efficacy, and clinical competence regarding palliative care, end-of-life care in generalist palliative care context. Out of 7, 6 studies indicate statistical significance. All studies indicate improvement in clinical practice after receiving the educational intervention. However, these findings only partially address the research question, as the research question intends to focus on nurses' critical thinking abilities in specialist palliative care context. Despite having a comprehensive search strategy and critical appraisal, this study has some limitations. This study only searched 2 databases, and gray literature wasn't searched. And it was part of my master's in palliative care, so time frame was very short for the study. Absence of high-level evidence can be considered as a limitation. Since the primary focus of the research question was intended to be specialist palliative care, the absence of data in specialist palliative care context can be considered as a gap in research. In conclusion, evidence generated is very rich and relevant and transferable to specialist palliative care. The research included in the study focused on short-term impacts of educational interventions for new nurses in specialist palliative care context. Further research is required to address the gaps in research regarding the impact of educational interventions in enhancing critical thinking skills of new nurses, non-specialized nurses in specialist palliative care context. There's a need to address the contextual facilitators and barriers to implementation of educational interventions in clinical practice. And creation of champions at ward level may enable and enhance a culture of learning. These are the list of the studies I have included in this evidence synthesis. And thank you for your time. I would like to thank my organization, St. Francis Hospice, for supporting me in this study, and my coordinators of the program, Dr. Georgia O'Donnell, Dr. Kamal Davies in UCD, and my librarian in St. Francis Hospice, Mr. David Keane and Dermot Stokes in UCD, and also my supervisor, Anita Duffy. Thank you so much.